No, Mr. Gill.
Good morning, my lord. The next witness, and indeed the only witness today, is Miss Tressa Burke. She is the representative of the Glasgow Disability Alliance, and what she is presenting us today with is an organisational statement on behalf of that organisation. The reference to her statement is SCI WT 000862.
Thank you. Now, Ms. Burke, in you come and make yourself comfortable, or as comfortable as you can. Now, Mr. Gale's going to ask you some questions. Mr. Gale, when you're ready.
Thank you, my lord. Hello, Miss Burke. Your full name is Tressa Burke, I think?
Yes.
And your personal details and your contact address are known to the inquiry. And you're here today as the CEO of Glasgow Disability Alliance.
Yep.
How long have you been the CEO of that organisation?
I've been at Glasgow Disability Alliance for 17 and a half years.
Yeah. And I think we know that it was formed over 20 years ago.
That's correct.
I think in 2001, as you say in your statement. And I will ask you a little bit about the aims and the nature of the organisation in a moment. But before we do that, you provided the inquiry with a statement, and I've just given the reference to it. You've also recently provided the inquiry with some further information, which is very helpful to the inquiry, because I think within that further information you've given us some further details of, and in particular surveys that your organisation has carried out. And also you've provided us with a number of quotes from members of your organisation that bring home the impact of the pandemic on disabled people. Is that right?
That's correct.
Yeah. Now, in order that we get all that information before the inquiry, what we are proposing to do is that the inquiry team, together with yourself, will revise your statement in the next few weeks and produce a revised version of your statement, which will then be published to all core participants and be made available more generally. And we will wait, obviously, until that is done before general publication. But at the moment, and for today's purposes, we will utilize the statement that you've given and that has been circulated. But as we go through it, I'll ask you occasionally to add some of the material that you've given in the material you provided to the inquiry, so we have some of that in context as we're going through it. You've also, as an organisation, responded to a Rule 8 notice from the inquiry, and we obviously have the information that's contained in that, and on behalf of the inquiry, we're very grateful to your organisation for the work that you've put in with the inquiry, and we are also aware that your organisation is not legally represented, so we realise that it is very much falling on you, principally, to do this, so we are very grateful to you. Right, can you tell us a little bit about GDA? I'll just call it GDA, we know who we're talking about. Yeah. Can you tell us a little bit about it? You say in your statement, at paragraph 5, that it's run by and for disabled people. And then in paragraph 6, you say GDA is a thriving disabled people-led organisation with in excess of 5,500 members across Greater Glasgow You were formed in 2001 and is the biggest membership groundswell of disabled people in Scotland. What are your aims?
Well, our aims are that disabled people get to participate and lead their own lives with the support that they need and with choices equal to other people, other non-disabled people. And the way that we think that we can do that is by promoting and supporting equality, rights and social justice. So the kind of nature of the work that we do is we provide individually holistic services, and it was originally historically built around learning and development. So we built people's confidence and capacity to take part in things. We raised people's, working with them, raised their aspirations to try things and be more involved in their own lives and decisions that affect them. So we did that, the learning and development programme. Added to that, we offer welfare rights, advice and representation so that people can maximise the income they're entitled to through benefits. We also provide digital support and coaching. That's something that was added during the pandemic. And we provide support for people to build their voices collectively so that they can speak out about the things that affect them and decisions that affect them and influence policies and service design as well. We also provide well-being. So again, that was something added during the pandemic. It's always been an issue for disabled people because there's a correlation between experiencing not just impairments and conditions, but the barriers that disabled people then face as a result of that. And mental health, there's always been that correlation, but the tsunami of mental distress and unwellness that people have experienced, the increased suicidal ideation has been awful, and so the GDA Wellbeing team supports people by giving one-to-one support on the phone. They also run group sessions for people who can take part either online or in person. So that's the kind of individual things. We've also got a research project funded by the Scottish Government at the moment, and that's looking at how disabled people can help shape the National Care Service. And so we help people navigate social care support and services connected to that as well, which is really important, and have a voice through our social care expert group. So those are the things that we do at an individual level. Collectively, we work to support disabled people to build their voices and their collective priorities, and work together with service providers to be able to design services that better meet their needs. So it's about amplification of the voices and the issues and the human rights that disabled people should have but don't have in reality. And then we collaborate with the government, with local authorities, the NHS, public sector and third sector as well, sharing the evidence and the insights that we've got from disabled people and doing it all with disabled people. I think that's the important thing. So when anybody asks me about Glasgow Disability Alliance, I think the really key thing that I would stress is that we are disabled people ourselves. So I'm a disabled person, my board are disabled people, more than half this team are disabled people. So we are working to the needs of disabled people, and we're run by our members, which is over 5,500 as you mentioned. So, and I think being a disabled person-led organisation during the pandemic and all of the time is so important, because there are so many people in the landscape who provide services to disabled people that then sometimes seek to speak for us, and it's really important that disabled people get to speak for themselves through our organisations that we control and manage ourselves. So that's kind of in a nutshell what GDA does and who we are.
Right. Well, I'm glad that was a nutshell. Now, you, in a perhaps a more precise nutshell, or more confined nutshell, you set that out in paragraph 10 of your statement. Can I just understand the range of disabilities that you cover? Because obviously we just a very simplistic level, one can identify obviously types of disabilities, but what sort of disabilities do you cover within the organisation?
Pretty much is, you know, the full range. So we work with disabled people who experience barriers, and that's the common collective thing that we're identifying and working with people on. So it might be people with physical impairments, mobility impairments, long-term health conditions. It might be disabled people who have learning difficulties or learning disabilities. It might be disabled people who have hearing impairments or visual impairments, or blind and deaf people, as sometimes people identify with those names rather than the impairments. It might be people who have head injuries or survivors of stroke, people who are neurodiverse, who are on the autistic spectrum. So it's the full range. I might have missed out some, but it's the full range of impairments. And the important thing is that people are united by the barriers that they experience. So we're not specialists in any one area. Our kind of area of specialism is supporting disabled people to tackle the barriers.
Okay, that's very helpful. The groups that you have access to and can inform the inquiry about, are there specific groups within the population that you have access to that you can tell us about?
Yeah.
And they would be, who would they be?
Right, so it's diverse disabled people, and by that I mean people who experience even more marginalisation. So not just disabled people who are white, middle class. We've got usually people facing quite extreme poverty and disadvantage. We've got black and minority ethnic disabled people. We've got lesbian, gay, bisexual, transgender disabled people. We have disabled women's networks. We have disabled young people in particular, older disabled people. So we have a range of networks that are what we would call the intersectional networks, not because the people are intersectional, they may have more than one protected characteristic under the Equality Act, but actually because the barriers and the oppression that they experience is intersectional and exponential, you know, in relation to that. So the more protected characteristics you have, the more barriers usually people face. So we get evidence from them and insights from them across a range of experiences in policy areas and service areas, and obviously one of those areas was COVID and the pandemic and how that affected people.
Yeah. And I think one of the groups that I think you've also mentioned, and I know from the information you've recently given the inquiry, you also have information from the refugee and asylum seeker community.
Yeah, that's correct.
Okay. Now, one of the points you've raised with the inquiry is that as a disabled persons organisation, it's important because it means that there is accountability and direction of the organisation which remains with disabled people themselves. And I think you have a mantra, or you call it a mantra, which is nothing about us without us. You just explain what that mantra reflects.
It reflects, I think, historical oppression that disabled people have experienced, and the kind of well-intended paternalism of the way services have been designed for disabled people rather than with them. And by consequence of that, the number of organisations and people who speak for us about what is best for us rather than asking disabled people themselves. So often very well-intended services, often before there were disabled people-led organisations, those were the people who knew, and they certainly do have a stake in what happens to disabled people and how services are provided, but they do not speak for disabled people any more than white people speak for black people or straight people speak for lesbian, gay, bisexual, transgender people. So, and I think that we're in a loop where we're not quite able to move forward from that, partly because of how hard it is for disabled people to self-organise. So disabled people-led organisations came about during the 60s and 70s, when disabled people staying in long-term institutional care started to ask questions about the nature of their care, the nature of their oppression, and the social model of disability developed from that. And it was an emancipatory way of looking at their circumstances that said, actually, is it me and my condition that's actually stopping me from going out and having a life and being able to go to university or socialise with my friends, or is it the fact that I'm in a care home and bedtime's 7 o'clock? Are those the things? And that's where that all comes from. So nothing about us without us is a kind of international slogan for disabled people in our movement, and GDA very much adopts that as well.
Yeah. I think one of the ways you also phrase this is that I think you've said that for a long time disabled people have been done to rather than people doing things along with you.
That's correct.
That sums it up, doesn't it?
That sums it up.
Yeah.
And that directly relates not just to disabled people's lives generally, but specifically in relation to services like social care. So people not having a say in the nature of the care that they need and get means that they don't get to live the life that they want to be able to live.
And in your statement, you set out at paragraphs 15 and 16 your vision and your mission. And perhaps you just, again, for point of view of summarising things, perhaps you could just read both 16 and 15 for us, 15 and 16 for us, please.
Our vision's a world where disabled people participate fully and lead our own lives with the support that we need to do this, with our human rights upheld, connecting with peers and opportunities, contributing to families, communities and wider society on a full and equal basis alongside non-disabled people. And our mission is to promote equality, rights and social justice with and for disabled people.
Right. Can I just ask about the way in which you conduct your work? Clearly, as an organisation, you will have contacts and connections and make contributions to decision making. And in that context, so far as GDA is concerned, who do you collaborate with in that context?
We are approached and respond to many opportunities. So, for example, with the Scottish Government and the NHS, with the Social Work Department in Glasgow, with third sector organisations, but we also seek out opportunities where disabled people raise issues that are important to them. So the issues that came up for us during the pandemic, we recorded them at the time, and we then fed them back to structures that set up like the Social Recovery Task Force in Glasgow, the Social Renewal Advisory Board at a Scottish Government level. We're collaborating on the National Care Service at the moment. We're collaborating on a minimum income guarantee being designed for Scotland. We're involved in the Poverty and Inequality Commission, which is very new. That's just happened this month. And the First Minister's Advisory Council on Women and Girls. And those are areas where we feed in disabled people's priorities. So the latter one is specifically disabled women and girls, but obviously disabled people across the board. So we work with a full range of people that we can within the resources we have.
Now, conscious of the fact that your organisation has been going for over 20 years, one of the issues that this inquiry is going to be looking into in due course is what is generally called pre-pandemic planning, and the sort of policies and possibly arrangements that are were put in place or had been put in place in anticipation of a pandemic. Were you involved in any of that prior to this pandemic hitting Scotland?
The simple answer is no. We weren't involved in pandemic planning or disaster planning or anything like that. We've been involved in planning for services and policies, but not specifically that kind of planning.
Yeah. With the benefit of hindsight, do you feel that you should have been?
Absolutely, yeah. One of the things that we reflect on at the time and since then is that disabled people really need to be involved in all of these things. If you look at disasters all around the world, Hurricane Katrina, you know, the war in Ukraine, disabled people fare very badly in these situations, and not being involved in the planning for them means that the actions that really need to be taken with speed don't happen. They either don't happen or they don't happen fast enough, and lives are lost as a result.
Okay. Now, I'm not going to ask you what, if you had been involved in that planning, what your contribution would have been to it, because I think that's probably, that's a day and a half in itself, I imagine. But it is interesting to note that you feel you should have been and you weren't.
Absolutely.
Okay. Now, you tell us a little about your funding base, and that's really not, for present purposes, something we need to go into in any great detail. Except I would like you to go to paragraph 20 of your statement. I think there you say that during the height of the pandemic, funding flowed and worries about how to meet needs were removed. And then you go on to say, however, this reverted to more normal and draconian practices which disadvantages disabled people's organizations because of a lack of understanding of the additional supports disabled people need and related investment required to enable this. Now, can you explain what you're getting at there, please?
What I'm getting at here is that during the pandemic, there was trust between the government and the local authorities and public partners and communities themselves, communities of place and communities of interest. There was an understanding that they couldn't fix it on their own, that they couldn't reach the people, even just in relation to the vaccine, which came a wee bit later, but in relation specifically to shielding at first. And that trust engendered the ability for us to be able to access funding that came from the UK government via the Scottish government directly into communities. And we were trusted that we were gleaning the issues by speaking to the people, and there was no question that that was the case. We were able to evidence it very, very easily, and we were able to apply for the funding to do what needs done. And as further we have got from the pandemic, that trust has been eroded. So sometimes, or it's more dissolved, as though it hadn't happened. Sometimes there's a sense of, well, how do we know that that's true? And you feel like saying, well, why did you trust us during the height of the pandemic, if not now? And I think that we've just reverted back to normal where funding is constrained, and that is a consideration for us as a country. I understand that. Funding is constrained. There's competitiveness about how you apply for and get that funding, and specifically in relation to disabled people-led organisation, because there's not an understanding of the multiple barriers and the levels of oppression that that causes for disabled people. There is similarly not an understanding of the actions and steps that need to be taken to remove those barriers. And so when you ask for funding for things like access facilitation, it's not understood, and it seemed that your bid or your proposal is more expensive than it needs to be. It's certainly not as competitive as organisations that are applying for funding to do similar things, but not with disabled people, for example. So that's really what I mean by that.
Okay. Yeah. Yes. One of the points you've made earlier, Ms. Burke, is that you use the word barriers for disabled people. And if we're looking at the barriers that existed pre the pandemic, what were those barriers for disabled people?
I think pre-pandemic, the barriers were always around poverty, deep, deep poverty, and we're seeing evidence coming out now that's confirming that from Joseph Rowntree, academic evidence, all sorts of evidence backs that up. And barriers to accessing the services and supports that disabled people need to be able to live their lives, so particularly around health and social care, barriers to employment, and that can be that sometimes disabled people don't have the same access to education and learning opportunities, so that they can't get onto the rung to get into the level of employment that they need. When they do get the employment, they tend to be in low-paid jobs. The employers don't always know how to make adjustments or support disabled people. There aren't progression opportunities for disabled people. So at the outset of the pandemic, there was a precarity for disabled people who were in certain types of employment, and that was very evident. People who'd really struggled had 17 interviews to get a job. And I remember one woman with 3 degrees telling me, and she was on a probation period, and in the end that just didn't continue. And I just think that employers need support. So employment is another area. Transport is a major barrier, so transport isn't always accessible, or disabled people can't afford it. Things that are, you might imagine, should be quite routine. Getting a blue badge so that disabled people who do drive or have access to a car can park in spaces near to where they need to go. That's actually full of barriers to even get that badge. Getting access to the supports that people need to be able to get into work, so the employability supports tend to be more focused on disabled people who are nearer job ready. So there are a range of barriers, and none of those things are touching on the stigma and the discrimination that disabled people face, just in general from the public, who I think don't understand disability, don't understand the barriers and the solutions that are needed, and also fuelled by quite a right-wing political ideology and a media that jump on that and that denote disabled people as benefit cheats and scroungers. So before the pandemic, there was a lot. The United Nations had declared it a humanitarian catastrophe. In 2017, they'd spoken about the grave and systematic violations of disabled people's rights. So we knew all of this going into the pandemic, and then obviously things, the inequalities were supercharged at that point.
So I think, again, one of the points you've made in that answer is that there's, in your view, there's an almost inherent discrimination against disabled people. Is that right?
That's correct.
Yeah. And how understandable is that? How it may be very obvious to you, but how understandable is that? How acceptable is that approach?
Is your question, how do people understand the barriers disabled people face? Is that what you mean? Yes.
Well, or do you think it is it inevitable that this discrimination exists?
So 2 things. One, I think people don't understand, and I think it's hidden away, and that's partly because disabled people are hidden away. I think that same lack of understanding and insight is built into institutions and organisations, including the NHS, including social work departments and integrated joint boards that are delivering health and social care integration and all the services around us. And I think it's not inevitable. I think that it is no more inevitable that disabled people experience poverty and inequality than that we have poverty in the first place. It's a result of political choices. It requires a political ideology to shift. It probably requires us to look at taxation as a country, and that's maybe for later down the line in my evidence, and I think it requires resources that we currently have and choices that we make to be prioritised to the people who need it most, and disabled people are surely amongst that group.
Right, let's have a look at what happened when the pandemic hit. Paragraph 22, you tell us that you were contacted by the Scottish Government at the start of lockdown, and because, as you say, we are a strategic partner of government, funded partly through government, they approached us, and you personally were asked to take place in a number of meetings due to DDA's connections to thousands of disabled people who were vulnerable and likely to experience heightened inequalities and problems. Now, Was that reassuring for you at the start of the pandemic, that there was that apparently outreach to you as an organisation by the government?
I think it was reassuring, very much so, because we are very used to disabled people being thought of as an afterthought. So as an upfront gesture, it felt reassuring, and it felt that we were immediately connected with people who would be making decisions. We didn't know what those decisions were going to be. We were all kind of experiencing it as it was evolving and rolling out, but it did feel reassuring that the Scottish Government was in touch. I was in touch on a weekly basis with the Equality Unit, feeding intel in. They knew that we had recruited lots of people and we were contacting thousands of people. They wanted to know what people were saying, what their experiences were, and that changed. It wasn't the same. Each week was a snapshot in time, but there were changes over that period. So it did feel reassuring, and it did feel that we had a route directly, not just to officials, but also to government ministers as well, which was incredibly helpful. Yeah.
And I think we see that you had, well, you mentioned the Scottish Government Equality Unit in paragraph 23, and you also say from the middle of March, the 16th of March 2020, you had numerous conversations with I imagine that unit to share insights and concerns of disabled people's experiences of the pandemic. Obviously, the pandemic was very early at that stage. What were you able to impart to that unit at that time, given that it was so early?
Point. Yeah, at that time, the main issues, which of course we had noted as an organisation as we were going along, so I've been able to look back on all these notes, and those concerns at that point were confusion, lack of information, lack of understanding, not knowing which set of rules applied. So in those very early weeks, there were obviously the Four Nations broadcasting, and people weren't 100% sure of which rules to follow, or indeed even having access to the information. Some of our members didn't have access to a TV or a phone. They were listening on the radio, so people were getting limited information. People didn't really know where to turn for support. So in our ultimately in our research, which wasn't conducted as research at the start, it was conducted as wellbeing check-ins, but what we discovered was that 80% of people didn't know where to turn in their communities. So I think the lack of knowing, confusion, bewilderment, a sense of panic. Some people weren't that bothered because they didn't think it was going to carry on. So there was the opposite. There were some people saying, "Oh, I'm fine, Hen, I'm absolutely fine, I'm watching the telly, it'll pass," and that kind of that spectrum of reaction, which obviously changed over the period.
Yeah. One of the things that the inquiry is hearing about, and it's a point you make subsequently in your statement, and particularly in relation to the surveys that you've carried out, is the isolation that people have experienced through lockdowns. Obviously, appreciate it's the very early days of the pandemic. Was that a concern to you at that time, or had that focused as a concern in the very early days?
It emerged immediately, and the reason is because disabled people are twice as likely to be socially isolated than non-disabled people in the first place. They're also disproportionately relying on services, and those services all stopped. So it became an issue much quicker than you might think because of that. Because if somebody had services and supports going in, and either those services were withdrawn or they themselves asked for them to be stopped out of fear, then they were suddenly isolated, not just isolated and lonely, but with no support and frightened. So it was enhanced, it was exaggerated because of that. So it wasn't the pandemic of social isolation that it became, but it was absolutely apparent even from the outset.
Yeah. In your discussions with government, was that concern about isolation in particular, was that, as far as you were aware, understood from the outset?
I think the things that we were focusing on at that point was setting up a helpline to give people the information and the support that they needed, making sure people had access to benefits advice, making sure people had access to wellbeing support. We were very quickly discovering that people didn't have access to food, and I think the isolation thing wasn't as apparent at that time amongst the weeks that emerged. You know, the first weeks is what I mean by that. But we were raising it as an issue, that the social isolation was coming up as an issue in relation to the mental health distress that people were experiencing as well. So one of the ways that we tried to tackle that was by getting people digitally connected and by moving all our programmes online, which I can maybe say a bit about later, but social isolation was there right from the start.
Yeah. Can I take you, again, I should have said earlier that obviously we have your whole statement, and your whole statement will be taken into consideration by the inquiry, and we will get a revised version of your statement. So again, that will be taken into account. So please don't think that because I'm moving from different paragraphs in your statement that certain things are being ignored. They're not. But if I could take you on to paragraph 29. This is at the end of March 2020, and you're talking about a meeting that you had with the Cabinet Secretary for Social Security and Older People, and also the Minister for Older People and Equalities. You met with other CEOs and staff from community-based organisations to think through and plan for meeting the needs of communities across Scotland. Now, obviously, that tends to suggest that that was at a fairly high level in terms of what was being planned. Is that right? It would be.
It didn't feel like that because it was a telephone conference.
Oh, right.
So it didn't feel high level, but it obviously was with people in the cabinet.
Yeah. I'm sorry, what I mean by high level is that it was very general in terms of its planning, rather than specifics. Yeah. And you say that in paragraph 30 that you were invited to let the ministers know about the needs identified, etc. You say that it was reassuring for GDA members to be informed that we were speaking to the government at the highest levels and passing on their concerns.
That's correct.
And were you perhaps should have asked you this before, you obviously report back to your members.
Yeah.
And how were you, even in the early days of the pandemic, how were you reporting back to them?
So in the very first weeks of the pandemic, we spent a lot of time trying to get people online who had access to that. As the weeks moved forward, we were needing to get devices and access to MiFis, which is a thing that connects people to broadband if they don't have broadband, which many people don't. So we were moving all our programmes online. But in the very, very early days, we were having telephone conversations with people. And then we were having, so with, for example, we've got a Drivers for Change network, which is about 200 plus members who are actively involved in the kind of almost campaign, the influence and change side of the work that we do. And we were having meetings online with them, or those of them who had access to that, while we were getting everybody else ready and getting them all online, which happened in the following weeks and months. So we were feeding back to members in that way straight away. I mean, the very first week, at the very, I think would it have been Friday the 20th, so it wasn't the first official week of the pandemic, but we'd gone home towards the end of that week. My team went home at the start, and myself and my office manager went home at the end, having tried to get everybody devices because we weren't set up to work from home. I reported to my board that Friday evening to say, here's my plan, here's what we're doing, here are the steps we're going to take in the coming weeks. So accountability, that's what I'm talking about being a DPO. They're disabled people, they wanted to know what are you doing for our members? What's the plan? How can we help? How can we all be involved in this? So straight away, the accountability was built in, and straight away, I was able to say, we're speaking to the government, we're feeding back concerns, which became really useful at the point that people were being approached about the DNRs, because we had that direct route into government to be able to tell them about that. And I can maybe touch on that later as well.
Yeah, we'll come to DNRs in a little. But just looking at, again, if we can, at the early days of the pandemic, and we can all remember it. I don't think any of us knew what was happening. So, but in those very early days, what was the, I don't know whether there was an overwhelming or a dominant feeling amongst your members at that time? What were they particularly concerned about?
So by the point that I had the meeting with the Cabinet Secretary and the Minister for Equalities, we'd spoken to over 500 people, because we basically turned all our resources to phoning everybody or texting if it was people who were deaf and hearing impaired, or emailing, mainly phoning. And the things that were coming out were people being very concerned and anxious, people not knowing where to go for support, information not being available in accessible formats, people not having access to digital supports, which they were becoming increasingly worried about if that was going to be something that GDA was doing, because we were looking to get people online so that we could run things. People not having food, that was major concern to them, and people not having access to the services that they needed, so social care and health. So I remember specifically one woman who'd been diagnosed, in fact this was not just one person, there was a few people that I can think of who'd been diagnosed with cancer, somebody else with diabetes, just at the outset, and the treatment stopped, the communication stopped, people with severe mental health illness and distress, somebody who'd been sectioned 7 times and who was bipolar, no access to the psychiatrist, no access to the CPNs, phones ringing off the hook. So those were the concerns in the first days, and food was becoming an increasing concern for thousands of people.
Well, 2 points, if I can take from that. And can I suggest to you, just for your comment, was there an element of fear within the disabled community at this time?
Absolutely. People were terrified, because the way that things were being talked about, people knew that they were vulnerable, was the word that was being used. People were vulnerable, and shielding was starting to be being spoken about, and people thought, you know, if they caught it, that they would just absolutely die. And many of our members, even in those early days, I remember my team feeding back to me, and me speaking to people as well, saying that they were worried that if they died, not just, the fear wasn't just if they died, the fear was that because they were so isolated in their lives before the pandemic, that nobody would find them and nobody would know, because we were the only people in touch with them. So that was a real fear for people. Some people were absolutely terrified.
Yeah. The second point, just again going back, and it's something you've mentioned several times, and I think it is something that you obviously wish to emphasise. The question of access to food. Well, I mean, I suppose we can all envisage it, but for a disabled person living on their own in Glasgow, without perhaps access to a car, without access to other people to do things for them, how serious, in your view, was the concern about getting access to food?
It was gravely serious, much more than we could have thought. We're not a food provider, that's not what we do, and we found ourselves providing food to over 2,800 people over the period. And the issue with food is that disabled people who weren't shielding didn't qualify for the way supermarkets were doing things, couldn't get the delivery slots, and that would have obviously involved them having enough money to order over a certain amount to get the free delivery anyway. So they couldn't qualify. Not all the people that should have been shielding were. Not all the people that were shielding were getting food that was appropriate to their diet or to their needs, given that many had their social care cut. So people described getting things like, I mean, there was a lot of laughter when we got to the online forums of people describing, you know, 2 bags of root vegetables turning up, and it was people who couldn't use their hands or didn't have access to their kitchens, because these things, all these cumulative interrelated barriers make disabled people more disabled. It's not just the conditions or the impairment. So the social care being cut, the house not being accessible in the first place, the types of things that were being delivered, and then nothing being delivered if they weren't on shielding. Food banks were great and are wonderful, but they don't deliver. They mainly don't deliver, and disabled people couldn't get there. They couldn't get there safely. They didn't have their own transport. You know, you couldn't safely get people to go, and they would have needed support anyway. So there was so many things. So we decided quite early on that we were going to set up a response and try and provide it was our lifeline response: food and resources, cleaning products, sanitary products, continence products to people who really needed it. And we thought it would be small numbers, and it ended up being thousands of people. We just couldn't have imagined it, and it's not what we had skills or experience doing, I have to say.
Obviously, there is a prevalence of online banking and now an increasing absence of a cash culture. Was that a problem?
That was a massive problem. People were terrified about not being able to pay their bills and being cut off. They couldn't access their own cash. Some disabled people don't have credit cards or cards with the debit function. People just not being able to go out and access their own money. That was a major problem. So we were delivering food, not always because people couldn't get the food, but sometimes because they couldn't get the cash. That was in smaller numbers, but that was a feature as well.
As you increased the range of services that you were offering, I should have asked this of you earlier. I think you mentioned that effectively you closed down, in the sense that you closed down your offices and started to work from home.
Yeah.
How many people did you have working for you?
At that point, we had 15.
Yeah. And during the course of the pandemic, did that number stay the same? Or did it increase?
It was a changing picture a lot of the time, but at the height of things, we had 45, and that was when we were phoning. So there was a point at which we were phoning, and only phoning, but then we were logging all these things, and then we were trying to respond. So we started at a point probably within the first couple of weeks, or after the first couple of weeks, trying to set up the responses. So getting all our online offers, which were the learning and development programmes, the voice-related activities, the collective voice, what are we wanting to tell the government about what's happening to us just now, the welfare rights, that was mainly provided by phone, but there were some online things there, and I think that's partly because the people accessing the welfare rights didn't have and couldn't afford broadband, and were often in chaos as well because of poverty. So we were getting all our existing things online, and then we were responding to the new things, which the newly enhanced or made worse, exacerbated mental health and well-being issues. That was one thing. The lifeline was a major thing, started up by our fabulous office manager, who got everything set up and turned our big training room into a food store, and recruited personal assistants who were already working with us to either change what they did and do that, or get new people to do that, because we really wanted people with cars so that people were safer as well. So we were doing lifeline, we were doing wellbeing, and then the digital offer, which was us working with the government, with Connecting Scotland, to try and get a hold of devices, MiFi's, which connects people to broadband, and then coach people who had never seen a device, who didn't know what a mouse was, who didn't understand what swipe meant, these types of basic things, and that took a lot of intense support. So we were still phoning people, still conducting a survey, which by that point, I think weeks in, we put it online to SurveyMonkey. That was completed by almost 2,500, and then there was obviously all the spreadsheet information we had as well. So we had a massive repository of insights and evidence with lots of case studies and action points for people who were then referring into all the services as they were being either transferred online or set up from scratch.
Okay. Paragraph 33 of your statement, you talk about you being appointed in June 2020 to the Scottish Government's Social Renewal Advisory Board, which sought to capture the human experience of COVID-19 by listening to and learning from lived experiences. So I take it this was another aspect of the work that you were doing.
Yeah.
That you were obtaining, you were not merely giving practical advice to people, but you were obtaining information from the disabled community so that you could feed that back into the government.
Yeah,
is that right?
yeah, absolutely. That's something that we always do. That's always been one of our aims from the day that we set up. So we really set up to combat social isolation and loneliness, and to be a collective voice, almost like a union for disabled people, feeding that into decision makers. And that came really to fruition and to its most usefulness at the height of the pandemic. That was one example of where we fed the information.
Yeah, this is slightly out of order, but can we go to paragraph 71 of your statement, please? I think here you set out some of the information that you collected. This obviously isn't at the very early days of the pandemic, but you provided us there with research that has shown that of 6,000 disabled people spoken to, there were certain matters repeatedly came up. And perhaps you could just take us through those, please.
Absolutely. So 82% were worried about social isolation and loneliness. 62% were worried about mental health. 92% were worried about both physical and mental health. 57% were worried about money and hardship. 47% were worried about having access to food. 80% were unaware of any local support services they needed and or were unable to access these supports, and 41% were unable to get information in the formats they needed. And this became more confusing as TV broadcast meant people hearing slightly different approaches being taken by the 4 devolved nations.
Right. And I don't know precisely when that data point was taken from.
5 months. After 5 months, we were able to analyse all the data at that point.
Thank you. And obviously that was the data at that point.
At the end of August.
Was that in your view, an accurate reflection of the concerns that you were hearing?
Absolutely. I would say the one that absolutely got worse as it continued was the food thing and the social isolation and loneliness. The 80% being unaware of local support services was up on research that we conducted, I think, the previous year or the year before that, where it was 71% weren't aware of how they could get support in their communities or didn't feel that they could be involved in their communities. So this has been a long-term pre-pandemic issue, which was just exacerbated by the pandemic.
And I think I should say to you, Ms. Burke, that the inquiry has commissioned some academic research on the availability of social care support during the pandemic and the changes that occurred during that. That is going to be published. In fact, I had a meeting about it on Monday. That will be published in the not too distant future. So we will ensure that that is sent to you, and we would obviously welcome your comments on it when you receive it.
Thank you.
Can I deal with a rather darker issue, and that's deaths from COVID? You provide some information on that in paragraphs 35 to 37. You give a figure in paragraph 35 of the number of members that you feel that you are aware of or suspect died of during the pandemic. I think you can update that.
Yeah, that's right. So in planning for giving the evidence, we worked really hard, my team worked really hard to pull together as much as we could about how many members had died. And when I met with the inquiry back in June, I had stated at that time that we had notice of 114 GDA members dying at that point. between March 2020 and the end of March 2022, which is just obviously out with the scope of the inquiry by a few months. Since then, we've had it confirmed that at least 215 members have died, and this is because we find out information from letters returned ongoing, sometimes a long time after the member dies. We know from families, if there are families, that many of these were COVID related, but we certainly don't have confirmation in every case, and we suspect that the figure might be higher, quite a bit higher, as we've lost touch with a number of members during the pandemic. So some of our members lived in care homes, some of the care homes have actually gone, so we've got no way of tracing the people. Some members moved away to live with their families, and we've simply not been able to trace them despite repeated efforts on our part. And I would just like to say that each person was a valued member of GDA, and you know, many people did have family and friends and loved ones who cared about them, and they all of the GDA members had GDA who cared about them, and it has just had untold human costs.
Right. You go on in your statement to talk about the start of the pandemic, and I think obviously we're familiar with many of the difficulties that your organisation faced. And indeed other organisations faced with the abandonment of face-to-face contact, etc. And you, in fact, had to cancel all face-to-face advice that you were being able to be given to your members, I think, is that right? And this takes us on, and again, it's slightly out of order, but one of the things you've been mentioning on a number of occasions has been the digital support. How did you transfer from what was your pre-pandemic mode of operation to the way in which you had to do it digitally?
Yeah, well, I think being small makes you more nimble and more able to respond in a more rapid way. So I think we had that privilege, and we also had the resources available. We had the connection with the government, we had the partnership with Connecting Scotland as well. So we had access to the equipment. So I think it's important to own that all up front. What we did was we basically, I mean, you know, I think I don't know if I say in this version of the statement or the revised one, but we are in no way IT experts, but we are participation experts. So what we were doing was making sure that disabled people could participate in the only way that was available at that time. So we got access to devices, we got access to MiFi. We had to get, I mean, it's such a process. You would think you could just give these things out. In order to give out an iPad, you need to register an Apple ID, you need to set up an email account for the person, you need to download all the apps that you might be taking them through to train them and use them, and I'm not a person that done any of this training, so it was Hannah, who is our digital inclusion manager, who led this up. That wasn't our job before the pandemic, but that's our job now, and working with a couple of really good people that had came on board to help us, who just had really good communication skills so that we were able to do the check-in calls and compassion. And those people together set about getting all these devices ready. Some of them were iPads, some of them were just laptops and other devices, and getting them out. So we had what was somebody who was our previous personal assistant helping people with support needs during the courses and events that we ran. He was then delivering these things out to people in a safe way and getting them set up, and then they would be coached over the phone. And you know, now looking back, we can hardly believe that we managed to do it. They were coaching people who'd never seen a device, never touched a device, didn't really necessarily always want a device, but we'd persuaded them to try, had been told they were too stupid to learn or too old to learn, had been turned down by other people who'd got devices because they were too disabled to be taught, and maybe the 3 sessions that were budgeted for by other organisations because that's all they had. So we had a no time limited approach to supporting people. We coached some asylum seekers and refugees and people whose first language wasn't English. I think we coached in 6 or 7 different languages. We had a blind coach working with us that we brought on to coach our visually impaired members, and it was just a process. And the way they did it was about finding out what was important to each person. So it was very much person-led learning and working out what they really wanted the device for. We hoped that it would be to connect with GDA and all our programmes and offers, but it was often also about, or sometimes only about, connecting with family, because everybody was separate from their family at that time. Shopping might have been a thing, but it was mainly the family, and then being able to contact GDA and being able to attend our online courses and events.
Just a couple of points, perhaps going on from that. Paragraph 44, and again it comes to your team switching to home working, and you list there what in numerical terms you were able to do, and we can read that, and in paragraph 49, you say that in the first year of the pandemic, and you list what you were able to achieve during that period, and quite clearly it is a very considerable effort that was made on behalf of your organisation.
I have a brilliant team, and they were extremely driven. As I say, more than half of them are disabled people, but they are all equally committed to the cause of trying to make sure at that point that we weren't letting anybody slip through the cracks. I mean, we felt that we were privileged, we had a mission, we had the resources, and it actually kept us going to be able to do these things to help people as well. So it was just a fantastic privilege in my own part to be able to lead the team and be amongst them, but they were just outstanding.
Just one other point before I think we'll take a break in just a few minutes. Just one other point, if I can go to paragraph 52, please. You say there that your organisation adapted our Rights Now welfare rights project, learning programme and future visions support to be delivered remotely online and by phone. And then over 2020 and 2021, events and programmes were almost entirely online, with face-to-face returning tentatively at the start of 2022. So I suppose one of the points you make later in this statement is a return to normality. So in early 2022, things were starting to return to normality for your organisation.
That's correct.
Yeah, and I think we see that some of the assistance that you were able to give, and I think in the various bullet points in paragraph 52, 497 individual clients secured arrears payments of over £205,000. As well as projecting financial gains, again, achieved by the Rights Now service. 565 people were supported by us to get online and to do online learning courses and peer support. And 128 people were supported by Future Visions for Social Care Programme. And hundreds more were supported with dealing with distress and being signposted when social care had been cut. So these were some of the things you were doing.
Yeah.
Lord, could we just pause there for a few moments?
15 minutes?
15 minutes will be fine, thank you.
11:15 then, everybody. Thank you. Right, now. Right, Mr. Gill.
Thank you, my Lord. Hello again, Ms. Burke. Can I focus on something you say in paragraph 55 of your statement? And this is around the engagement that your organisation carried out, and it uncovered a massive spike in mental ill health and distress, accompanied with much support being withdrawn from services. For example, community nurses, community psychiatric nurses, and access to psychiatry. Yeah, can you just tell us a little bit more about that, please?
Yeah, as I kind of touched on before, I suppose the fear that people were experiencing combined with the support being withdrawn. So across the board, social care, as we know, the near collapse of the whole system in certain parts of Scotland anyway, but also access to health services like CPNs and access to psychiatry. So our wellbeing service was set up to deal with what we thought was going to be low-level preventative, keeping people well, but it was quite overwhelmed with suicidal ideation, people in extreme distress, people who perhaps needed to be seen by their psychiatrist and maybe even hospitalised in some cases, and it has become increasingly challenging. And what we found in the time since, I mean, the pandemic is over, as in the height of it, but the fears around COVID are still very live for some disabled people who either don't have protection from the vaccine or have mental distress, and or who don't have the practical support, the social care support to be able to get ready to go out. So for all sorts of different reasons, people are stuck in and are lonely and are isolated. So what we hoped was we were going to be dealing with those low-level preventative things, but what we've ended up dealing with is becoming almost a service in itself, which was not the intention, and is very difficult to sustain. It's very difficult to actually get the funding to keep it all going.
I think you say that what were initially started as check-in calls developed into a specialist well-being service, and you say that well-being workers supporting 529 disabled people in the first year.
That's correct.
And that was presumably something that you could not have anticipated.
We couldn't have anticipated it. I mean, when you set up a disabled person-led organisation, because of all the barriers and gaps and challenges people face, you could choose to set up doing a number of things. We chose to set up bringing disabled people together and reducing isolation and helping build their individual and collective voices and trying to make services better. But what has happened is we've ended up stepping in to fill the gaps of some services, and wellbeing and mental health are amongst those, and that's just where we are, and the problem continues.
Can we move on to shielding, please? And this is in paragraphs 56 and following. I think one of the problems that you highlight is that not all people who one might have anticipated would have been shielders received communications to that effect. Is that right?
Yeah, that's absolutely right. So there was a lot of confusion. I remember speaking specifically to people myself, mainly at the online meetings and events, who said because I had a respiratory condition and I'd had a virus that had resulted in a head injury, and I was in a coma, and I had all these different comorbidities, I assumed I'd be on the shielding list. I phoned my GP multiple times, nobody got back to me. So that comment about many didn't make the list but were extremely high risk or vulnerable due to comorbidities it's still outstanding in relation to access to treatment, but it was very much a gatekeeper of people getting access to support through shielding at that time. Very, very big concern. So people, a particular friend and colleague of mine at the time who has nearly died a number of times because of respiratory considerations, again not being put on the shielding list, and I think that just wasn't taken into account. So it seemed that they had a rationale, it will be evidence-based, they had a list, but rather than refining it and developing it, it seemed to stop at a certain point, so people just didn't get the support that they needed because it was cut off.
And I think having access to the information you've provided us with, you have a number of quotes from members, and I'm not ignoring these at all, Ms. Burke, but just for time pressures, when you prepare the revised statement, we will incorporate all these quotations into there so that we do have them. But I think you summarise the situation at paragraph 62, and you use the expression "lessons must be learned," which is obviously a matter for this inquiry. Can you just tell us what you think the lessons should be learnt in relation to shielding?
In relation to shielding, well, I think the communications was one part of it. I think how they determined who was on the list should definitely take account of comorbidities. We know much more about the virus now than we did then, and I think we have known a lot for some time, and it didn't seem that the list was changed. There was a specific issue around disabled children not getting access to the vaccine, and maybe not considered in the shielding category. I'm not 100% sure of that, but there was an issue about that. But I think it's much more about the comorbidities, how the decisions were taken, involving disabled people's organisations, not necessarily in determining the science, of course, because that's not an area of expertise that we have, but at least in helping to communicate the messages so that we could share them with our constituents, with our members, which cover hundreds of thousands of people in Scotland between us.
The next section of your statement is about digital exclusion, and this is a lot of what you say there is something we've already touched on. And I know, again, it's a matter on which you have some quotations from your members, and again, you will be providing us with that. You do mention, and it's really about, I think, the first time you do mention it in the statement, though we looked at it earlier, about at paragraph 68, that you as an organisation were never involved or never invited to be involved in pre-pandemic planning. So we've heard your views on that. And I think you've identified that this issue around digital exclusion could have been foreseen, and there should have been more effective and meaningful planning could have taken place. When you say that it could have been foreseen, was it obvious to you?
Yes, it was obvious to us that disabled people were digitally excluded before the pandemic. Reports had been written on this, so it was obvious to everybody, but no notice was necessarily taken of it when resources were being directed or actions were being planned around it. So it was an obvious thing, and still we have the situation where MiFi devices that give people access to broadband are now being stopped for disabled people. So we're scrambling around trying to find funding to keep people connected and not take off them the access to broadband and the web that they've had over the last few years since we've been supporting them.
Yeah. Can we move on to DNACPR that you talk about in paragraph 74 and following? Now, we've heard a little bit about this as a subject in the context of care homes that we've been looking at, and you may well have become aware of that. So far as your cohort of disabled people are concerned, what was being disclosed to you in relation to do not resuscitate notices, and what were the concerns about that?
It wasn't apparent at first, but it became apparent as we continued the wellbeing check-ins, but also just the engagement that we were having around providing supports and programmes and services to the disabled people we were supporting. What people were describing was being contacted by their GPs and being asked, kind of almost in passing, if you wouldn't want rigorous efforts, heroic efforts to be made almost persuading them not to say no to that. A lot became apparent to us online as well through Twitter, so we were being copied into tweets where people were being approached and were alarmed by this as well. Some people were finding out because their GP surgery were approaching them. Some people were finding out because they discovered it while they were in hospital, or when something had happened to them, they discovered it in passing. So people were absolutely terrified and felt that the lives of disabled people were being devalued, even the way that it was being described when people were dying, but they had a pre-existing condition, as if that somehow rewrites or writes off their life and devalues it. And we should just expect all the disabled people to die anyway, and they're not that worth saving. And there was obviously, coupled with this, there was the experiences of people being told they wouldn't be taken to hospital if they got COVID, if they became ill. If they were, they wouldn't necessarily be given access to ventilators. So there was a lot of fear, a lot of hype, a lot of people genuinely distressed and terrified because of this, and the DNRs compounded it to such an extent that myself and my friend and colleague who ran another DPO, Inclusion Scotland, wrote to the government, and we managed to get her onto the clinical advisory group to advise them of this, to try and sort some of this out, because I think things were being done with good intentions, but they weren't being thought through, and it had unintended consequences.
One of the things that we've encountered so far in the inquiry has been where there is a do not resuscitate notice, then that should at least be prefaced by an informed discussion with either the individual about whom it relates or their family. And then an informed decision can be made about it. But you're indicating that, so far as a lot of your members are concerned, that wasn't happening, and what was being created was, I think you describe it as fear and a level of hysteria.
Yes, that's absolutely true. I think when you consider that the people being approached that we were speaking to were people who were attending our learning events online and our activities, these were people not at near end of life stage. It wasn't appropriate to be having those conversations out of the blue with them on those occasions that it was happening. I remember one woman reporting to me that her mum had received a phone call, had agreed because she thought that's what the receptionist wanted her to agree. It was the doctor's receptionist that had phoned her, and she herself was a physio, and her and her sisters had to speak to her mum and explain there's a lot between resuscitation and care that you can be given. Just saying no to all care is not necessarily what you'd want to do. So she was supported by her daughters to call her surgery back and have that changed, which we checked up to make sure that that had been done, and it had been done. But how many people were persuaded or just went along with it, not fully understanding what they were being asked to do? And I think the thing about it being inappropriate at the stage of life that it was being discussed at, or the types of conditions that people had. I mean, there was an example of somebody deaf. This was on Twitter, this wasn't somebody known to me, but somebody deaf having it on their file because they were deaf, and that just doesn't seem to make much sense at all.
And presumably a lot of your disabled members wouldn't necessarily have been frail and elderly.
That's correct.
Okay, intersectional barriers is a section you discuss briefly, but I think it's probably for us important. Perhaps you just explain, because you talk about the triple whammy. Explain what that is.
So triple whammy is a report. Actually, I wrote the report, but it was very much a team effort, and we engaged with disabled people, with disabled women on their specific experiences, and it actually spanned 2 years. So just before the pandemic started, we had our first engagement, and it ran right up until the end of March 2022, and it basically found that if you are disabled and a woman and experience COVID, it was a triple whammy of barriers. So all the things that make disabled people's life less equal in the first place make it even more less equal if you happen to be a woman as well, and then COVID on top of that supercharged the barriers and the life chances and the outcomes for disabled women.
Yeah. Now we go on to future focus, which I think is obviously a very significant section of your statement, and I think having seen what you also wish to bring to the attention of the inquiry, there is more material which, when your revised statement is produced, there will be quite a lot more within there. But I think, so far as what you've said in your statement that is before us at the moment, it encapsulates a lot of the issues that you've discussed with us today. And I think from our point of view, I think it would be useful if you would just read through from paragraph 80 to the end of paragraph 88, please.
So GDA has drawn on the lived experience of over 6,000 disabled people to consider lessons learned. GDA was able to step in when all other support failed or could not be found in a range of circumstances. On top of supports already mentioned, other supports included sourcing and supplying white goods for people whose appliances had failed, organising bulk removal of rubbish causing health and safety hazard in the homes of disabled people, providing a portable ramp in one case to someone unable to access their parents' home when they'd moved in order to receive personal care that had been removed by the local authority, sourcing and providing commodes, and organising laundry pick-up and return services for people whose home help services had been removed, including someone living with incontinence.
Please continue. Just read on to the end of your statement, please.
Thank you. Disabled people were not ready for a pandemic. No specific consideration had been given to disabled people in planning for a pandemic. We want disabled people to be involved in future planning and also in planning for recovery and renewal after this pandemic.
I'm sorry, having asked you to read on, can I just pause you there? Sure. So far as involvement of disabled people such as your group in future planning, how would you see that operating? What form would you see that taking?
I think it would need to be at a national level with Scottish Government, but also at local authority level as well. So there's people in every area in Scotland who are on standby for disasters and planning in communities. And I think if disabled people were involved in those conversations, explaining some of the considerations they need to think about, it would help them with their plans and their strategies and the actions that they would need to take early on in responding to these crises.
And I take it that's something that you personally would be willing to participate in.
Absolutely, and I think the disabled people's organisations across Scotland would be. I can say that with confidence.
Okay, right. Please go back to paragraph 83, please.
We wish inclusive, accessible communication for all, involving disabled people in communications planning so that disabled people can access information on an equal basis. Disabled people fall through gaps in almost every policy area and always have done, and that's just what happened here. Even though shielding was supposed to be targeted to them, it did not serve all of those in most need, and we would wish the shielding list to be extended if this was ever to happen again. At the very least, we would ask to be involved in dialogue and deliberation and to influence decision-making about such approaches based on our lived experience during COVID-19. We, as an organisation, had to do far more than we should ever have had to do. Although we're proud of our organisational response and the part we played in supporting disabled people, I firmly believe that the wider response just replicated the general exclusion, stigma and discrimination which disabled people face based on a lack of understanding about disabled people's lives, barriers faced and solutions needed.
Keep going.
It was inevitable that mistakes were made, and there is now an opportunity for these to be acknowledged and for us to learn the lessons on which we can build for the future. My ongoing concern is that the aim of the majority has been to get back to some kind of normal, and normal never worked for disabled people in the first place because the world was designed without us in mind. We've known about disabled people's inequality and eroded human rights for many years. Books and theses have been written on the subject. At the outset of the pandemic, I outlined concerns to the Scottish Government that history has shown that when major disaster hits, whether that's austerity and crisis, disabled people are very much shuffled to the bottom of society. Wars such as Ukraine and natural disasters like the climate emergencies in Katrina and New Orleans are examples of where disabled people fare worst, being missed out of evacuation procedures yet again. I stated GDA's intention to make sure this didn't happen again and our commitment to working with Scottish Government and others towards the best outcomes for disabled people. Despite this, disabled people have experienced amongst, if not above all, the worst outcomes, dying in the highest numbers as shown by various reports, including the national records of Scotland's deaths involving coronavirus in Scotland 24 March 2021. Disabled people were more likely than non-disabled people to have died with COVID-19 between March 2020 and January 21. Deaths of disabled people accounted for almost 6 in 10, 58%. Deaths involving COVID in the study population, and then it says 4,333 of 7,490 deaths. That's a quote.
Yeah.
Disabled people need now more than ever to be prioritising policies and actions to tackle the pre-existing inequalities which were supercharged, as well as the new ones created. We must ask ourselves as a country, what is our motivation, what is our capacity, and what are the opportunities for change? Much of this will depend on political leadership and resources, and if we can make progress on the motivation factor, the rest will follow. This will depend on building understanding of disabled people's lives and working with disabled people in organisations to build services and supports which ensure that disabled people are never again left behind, fearing for our very lives, not only because of a deadly virus, but because of how devalued and dehumanised we are by society. This might seem dramatic, and I'm afraid that's because it is.
One of the points you made early in your statement, Ms. Burke, was about funding. Obviously, we appreciate from your statement that GDA is funded. Is there a requirement for? It's a rather rhetorical question. Is there a requirement for additional funding for organisations such as yours?
Absolutely. There should be an organisation like GDA in every part of Scotland. Each of the 32 local authorities and the national organisations are needed as well for the policy work they do and the advice they give government and the Parliament as well. I have a couple more things to add, if that's okay.
Yes, please do.
So I think in terms of the lessons learned, I was thinking about this in a wee bit more detail. I think kind of 5 things are what really needs to happen. We really need to look at what went wrong and build on what worked. And there's lots of evidence of what worked from GDA and others. We need to involve DPOs in the plans and actions that are made. And we need to invest in them, and that does require investment unapologetically. I think the return on investment is massive and has saved lives in this instance. We really need to invest in public services, particularly health and social care, and we need, I know as a country, to look at affordability. I think that's a matter for politicians, but it does concern us all, and there are great ideas that have been suggested around progressive taxation that have come from the Accounts Commission and the Scottish Fiscal Commission, the Poverty and Inequality Commission as well. So we're not starting from scratch with these ideas. Disabled people certainly want to be and are willing to be involved in helping shape up these ideas, because affordability is what's always thrown back. But if we don't invest in the services of health and social care, we're going to be in a much, much worse position. And the Accounts Commission has just warned of this, as well as the Fiscal Commission as well. We need to build understanding of why the investment in public services are needed, why we need to look at progressive taxation, and I think we need to build understanding of the reality in our case of disabled people's lives, of the poverty and inequality and the kinds of solutions that are required. And then the 5th thing, it's probably hard to separate all those things, but the 5th thing is that we need an action plan. We need actions that embed disabled people's rights. One of those things needs to be about incorporation of the United Nations Convention on the Rights of Disabled People, and we need to incorporate the standalone rights like Article 19, the right to independent living, Article 9 about accessibility, and all the other rights that disabled people don't have in the Equality Act or in any other acts that we have. So that's something, and we need a plan. And there are opportunities. So we're working with the government just now on an immediate priorities plan. We're looking at a range range of actions about tackling poverty and inequality, about accessible welfare rights provision, the adequacy of disability benefits, and a whole range of other things. And we really need to come up with that pretty fast if it's to be an immediate plan. And the National Care Service obviously gives us some hope as well, because that is about health and social care, and that's one of the major areas that we need to look at. So that's kind of the end of my thinking about what needs to be done, but there's a long list.
Thank you. I can respond at least to one point on the UN Convention on the Rights of Disabled People. That is something that is discussed at some length in the academic research that we've had. So you may be interested in looking at that.
Definitely.
But subject to that, Ms. Burke, thank you very much for your evidence. We're very, very appreciative of it, and we will be in touch with you for two things. One, to get a revised version of your statement, which will incorporate a lot of the other material that you would like us to look at. And we will also be in touch with you to ascertain if there are any members of your group who might be interested in giving direct evidence to the inquiry.
Thank you. Thanks, Mr. Gill.
Yes,
Thanks
thank
a
you.
lot.
Very good. Tomorrow morning then, Mr. Gill?
It is indeed, my lord, yes.
Very good.